This is a short video working with the Trust communications team and senior management on the role of trade unions and their accredited representatives within Northamptonshire Healthcare Foundation Trust.
Good morning, Willowbrook Health Centre.
So first of all, what is a trade union?
It's an organisation working for the benefits of its members. It's trying to improve their outcomes. Working together, it gives them strength, it gives them a larger voice, and it helps them to tackle issues. Often within the NHS, our unions are profession specific and referred to as a professional body. There are a number of trade unions within NHFT for formal consultation and negotiation purposes, and these are set out in our Trust Partnership Agreement. A number of these names will be very familiar to you. Trade unions work for the interests of their members on issues of employment such as fairness of pay, safe working conditions, staff well-being, working hours and other benefits. They safeguard the interests of members and are involved in negotiating agreements both locally and nationally. Unions ensure staff are treated with respect and strive to make the workplace more inclusive for women, for disabled workers, for older workers, for LGBTQ workers and for black and minority ethnic workers.
How do trade unions work within Northamptonshire Healthcare Foundation Trust, and what is an accredited representative?
Our accredited trade union representatives are frontline staff working within different services throughout the Trust. They're union members who have volunteered and following election undergone additional training from their unions. The training allows them to support and represent fellow members should you have a problem at work. Representatives are there to discuss any concerns you have about your employer or employment. For example, they can attend formal meetings with you, things such as sickness, grievance, disciplinary. They represent members in local negotiations, organisational change, and are involved in the development and review of our Trust human resource policies. Accredited representatives work in partnership along with senior managers to find resolutions to workplace issues and concerns. They are also involved in developing best possible health and safety procedures and improving staff well-being.
What is Staffside?
Staffside is made up of these locally accredited representatives working jointly together for the benefit of their members, staff and service users. They meet regularly to discuss both operational and strategic issues which affect staff. Effective partnership working relies on good communication, openness and honesty, and a willingness to find common goals, but also, when needed, to challenge and negotiate. Building healthy working relationships and networks are vital to find a consensus to resolve issues.
As you know, Northamptonshire Healthcare is a really large and diverse organisation, employing about 4,500 staff. And all those staff are based across a whole range of sites across Northamptonshire, but also over the boundaries. So it's really important for us as an organisation to support our staff in as many different ways as possible. And Staffside play a really important role in that.
One of the things that I want to share with you is the importance of what we strive for here, which is outstanding and high quality care for everybody. But the only way we can do that is through our staff. It's really important to us that our staff are cared for and supported, because they're the ones that are delivering that high quality, outstanding care. And of course, Staffside really help us significantly with that, because they work very closely with us, they work in partnership, they absolutely recognise that keeping everyone safe, and safety is the biggest priority in this trust, is what we all do. So they support staff, they recognise the needs of staff, and through that we're able to understand what's happening, what we need to pay attention to, and what we need to actually focus on together to really make a difference to staff's well-being, but also to support that outstanding high quality care. I really believe that partnership makes a big difference to us. It's absolutely been instrumental in achieving the outstanding ratings that we've got, and also recognises the importance of the role in the trust too.
So should I join a trade union?
It's something you seriously need to consider. It's a bit like home or car insurance. When things are going great, that's brilliant. But if you have an employment issue, that's when the benefits of being the member of a union really shine through. You will have access to a local representative who can provide advice and support you through difficult times, such as organisational change, performance issues, grievance, disciplinary, sickness and maternity. Just like car and home insurance, you can't buy membership after the event and expect to be covered. This is why we recommend that you seriously consider joining your union or professional body. Joining your union gives strength to the collective voice at both local and national level. It's also less expensive than you think because it's tax deductible.
Could you give us some examples of the things you've done in NHFT?
Some of the things we've achieved locally, working in partnership, include financially more advantageous mileage rate for staff driving high mileages for work. We've introduced recruitment incentives, flexible working to allow a better work-life balance. We've become an accredited living wage employer. Extended notice periods for clinical staff. We've challenged downgrading and managed to achieve some increase in grading. We've improved pay for apprentices and been involved in improved wellbeing for staff.
A lot of engagement and consultation with staff, but the trade unions work with staff in a different way. They're able to get a clear view from them and able to come and bring that view to us. And working jointly together, getting the view from the trade unions, getting the view from the management side, we're able to find solutions to problems. We're able to communicate issues, ensure that issues are shared around the organisation and are shared with staff. Also, if staff are concerned about anything, we're able to give reassurance to staff by talking to the trade unions or explaining what issues are coming up. And we do involve them very much in the direction of the trust, sharing where the trust is going, getting input from them on what we need to do. And that's a really positive part of what NHFT is about. And when we've got any change to go through, and change can always be challenging for anybody, we always make sure that any change we've got, we talk through in detail with the staff side. And that really allows us to assure staff about the purpose of change, to make sure that staff feel supported, that staff feel engaged. So in all of that, the trade unions provide a really important viewpoint. They work with us, they solve problems with us, and they're a key part of the organisation and how it works. And obviously because of that, we encourage staff to join the trade unions because we see that as a really positive thing.
If you wish to find out more information about becoming a trade union member or your Staffside representatives, please check out the Staffside page on the staff room. Remember that by joining a union, you open the door to a number of benefits which include advice, support and help at work when you need it, advice on employment issues. Many unions offer financial assistance and debt advice at times of need, plus assistance if injured at work. Unions provide education and training, and in addition have many members' discount schemes.